Welcome to Quick Medical Review. Today's schizophrenia in under 5 minutes. Let's go. Buzzwords first. Positive symptoms, delusions, hallucinations, disorganized speech. Negative symptoms, flat affect, avolition, social withdrawal, poverty of speech. 6 months duration required for diagnosis. Auditory hallucinations, the most common type in schizophrenia. Tardive dyskinesia, repetitive facial movements, complication of antipsychotics. Neuroleptic malignant syndrome fever, rigidity, elevated CPK antipsychotic emergency. Let's break it down. Schizophrenia, a severe psychotic disorder, causes significant functional impairment, typically begins in late adolescence or early adulthood. Risk factors: family history, maternal malnutrition, or illness during pregnancy. Higher rates in homeless populations from downward drift. Inability to function leads to loss of social status. Diagnosis requires 2 or more of the following for at least 1 month within a 6-month period, plus impaired social function for over 6 months. Positive symptoms, delusions, false beliefs that persist despite proof to the contrary. Hallucinations, sensory perceptions without external stimuli. Auditory are most common, hearing voices. Disorganized speech, circumstantiality, tangentiality, loose associations, word salad, neologisms, disorganized or catatonic behavior. Negative symptoms, social withdrawal, flat affect, avolition, apathy, anhedonia, poverty of speech, thought blocking. Patients with predominantly negative symptoms, worse prognosis. Treatment: antipsychotics the mainstay. Typical first-generation high-potency haloperidol, more extrapyramidal side effects, fewer anticholinergic effects. Low-potency chlorpromazine, fewer EPS, more anticholinergic effects. Atypical second-generation clozapine, risperidone, olanzapine, quetiapine, aripiprazole, fewer EPS, but metabolic side effects: weight gain, diabetes, dyslipidemia. Clozapine reserved for treatment-resistant schizophrenia. Risk of agranulocytosis requires regular CBC monitoring. Psychotic exacerbations may require hospitalization. Psychotherapy helps patients recognize symptoms. Complications of antipsychotics: tardive dyskinesia, repetitive facial movements, lip smacking, chewing after months of therapy may be irreversible. Stop the offending drug. Neuroleptic malignant syndrome, fever, encephalopathy, vitals unstable, elevated CPK, rigidity, high mortality. Treat by stopping the drug dantrolene. Supportive care. Example: schizophrenia requires 6 months of symptoms, 2 or more criteria for at least 1 month. Negative symptoms carry worse prognosis. Tardive dyskinesia, lip smacking after months. NMS, fever plus rigidity plus elevated CPK. Stop drug, give dantrolene. Clozapine for refractory cases. Monitor CBC for agranulocytosis. That was Schizophrenia on Quick Medical Review. Study smart, not hard.